More than 60% of adults over the age of 60 have high blood pressure. That's not a small number, that's the majority. And yet, most people don't feel it. There are no obvious symptoms. No pain, no warning. That's why high blood pressure is called the silent killer. But here's what the medical community doesn't always lead with. Lifestyle changes alone can lower blood pressure as effectively as medication in many people. Not supplements, not quick fixes, real, proven, sustainable habits that your body responds to within weeks. Today we're covering the most powerful natural strategies for lowering blood pressure, backed by decades of clinical research. If you have high blood pressure, or you're trying to prevent it, this video could genuinely change your health. First, let's understand what we're dealing with. Blood pressure is measured with two numbers, systolic over diastolic. A normal reading is around 120/80. High blood pressure, or hypertension, is generally defined as 130/80 or higher. When pressure is consistently too high, it damages the inner walls of your arteries. Over time, this leads to atherosclerosis, heart attack, stroke, kidney damage, and vision problems. The good news is that blood pressure is one of the most responsive health markers to lifestyle change. The body responds quickly, sometimes within days. The most well-researched dietary approach for lowering blood pressure is the DASH diet, Dietary Approaches to Stop Hypertension. It was developed specifically for this purpose, and the results are remarkable. Studies show the DASH diet can lower systolic blood pressure by 8 to 14 points, which is as much as some medications achieve. The DASH diet focuses on fruits and vegetables, aim for 8 to 10 servings a day. Whole grains like oats, brown rice, and whole wheat bread. Low-fat dairy for calcium and potassium. Lean proteins, fish, chicken, beans, and nuts. And it limits red meat, added sugars, and sodium. The potassium in these foods is especially powerful. Potassium helps your kidneys flush out sodium, which directly reduces blood pressure. Bananas, sweet potatoes, spinach, and avocados are all excellent sources. Sodium is one of the most direct triggers for high blood pressure. The American Heart Association recommends no more than 500 milligrams per day for adults over 60. That's less than a teaspoon of salt. But here's the catch. About 70% of the sodium in the American diet doesn't come from the salt shaker. It comes from processed and packaged foods, bread, canned soups, deli meats, restaurant meals, sauces, and condiments. Reading nutrition labels and cooking more at home are the two most powerful tools. Season your food with herbs, garlic, lemon, and spices instead of salt. Your taste buds adapt within a few weeks, and your blood pressure often follows. Exercise is one of the fastest ways to lower blood pressure naturally. Regular aerobic exercise, walking, swimming, cycling, can reduce systolic blood pressure by 5 to 8 points in people with hypertension. The key is consistency. Aim for 30 minutes of moderate intensity activity most days of the week. If 30 minutes feels like too much, start with 10-minute walks 3 times a day. The research shows that adds up just as effectively. Strength training also helps. 2 sessions per week of resistance exercise, even using just your body weight or light bands, has been shown to provide additional blood pressure benefits beyond cardio alone. Chronic stress keeps your blood pressure elevated through constant activation of your fight or flight response. Managing stress isn't optional for heart health, it's essential. Proven stress reduction techniques include deep breathing exercises. Even 5 minutes of slow, controlled breathing can lower blood pressure acutely. Meditation and mindfulness. Gentle yoga, time in nature. Social connection. Sleep matters more than most people realize. Poor sleep raises blood pressure the next day, and chronic sleep deprivation is a significant risk factor for hypertension. Aim for 7 to 9 hours. If you snore heavily, ask your doctor about sleep apnea. It's a major and underdiagnosed cause of high blood pressure. Alcohol also raises blood pressure. More than 1 drink per day for women, or 2 for men, is associated with elevated blood pressure. Reducing alcohol intake often shows results quickly. Even a modest weight loss of 5 to 10 pounds can meaningfully lower blood pressure. Every 2 pounds lost reduces systolic pressure by roughly 1 point. It adds up. If you smoke, quitting is the single most powerful step you can take for your cardiovascular health. Within 1 year of quitting, cardiovascular risk drops dramatically. High blood pressure doesn't have to be a life sentence of medication, though for many people, medication is appropriate and important. What we've talked about today works. The DASH diet, reducing sodium, moving your body, managing stress, sleeping better, limiting alcohol. These are not difficult changes. They're small, sustainable shifts, and together, they can transform your numbers and protect your heart, brain, and kidneys for years to come. As always, please work with your doctor before making changes to your blood pressure treatment. Never stop or reduce medication without medical guidance. Take care of yourself. I'll see you in the next one.